Hi there. Thank you once again for joining me on the program, Your Doctor and Covid. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. The program is Your Doctor and Covid, and of course we continue our conversations speaking about the COVID-19 pandemic, the way it has ravaged the world, and the way it continues to have a role in our daily lives right here in Guyana. The basic things remain the same. It remains true from the beginning to now. We recommend that people wear their mask. You sanitize as often as possible by washing your hands, and of course to maintain social distancing. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. The correct way to wear your mask, of course, is to wear it to cover both the nose and the mouth, as I am doing now. But I'll take it off using the straps so that we could continue our conversations today. We are in the beginning of April 2021, and the pandemic seems to be having an increased effect in Guyana. We are in the midst of a surge for positive cases. We are in an unfortunate surge in rising death rates among persons admitted with a positive COVID-19 diagnosis. This is very unfortunate, and it has left a lot of families in mourning, and a lot of communities have been touched, and a lot of people are involved. A lot of persons have been exposed, and people are scared. People are unsure of what to do, but the simple things remain true as it was in the beginning. Wear your mask, wash your hands, and maintain social distancing. Avoid crowds. Do not congregate in places that, especially among people you don't know, or strangers, or people who are not in your regular circle. If you don't have to leave the house, don't leave the house. And always remember that if you need help, you can call for assistance. There are all kinds of available hotlines for you to call for attention. In early April now, 2021, we are in the full swing of the vaccination program in Guyana. We have started just about a month now, and so far we have been able to vaccinate over 40,000 persons. As of now, we should have about over 100 vaccination sites spread across the country. And so most people are able now to have access to a vaccination site. So the issue really is a choice. Will you choose to have the vaccine, or will you not choose to have the vaccine? It's an important choice to make, but I want to tell you, like every medical decision that you make, every medical intervention that is done, there are risks involved. And the most important question you have to ask yourself is, are the risks more than the benefits? And if you believe that the risks are more than the benefits, then you make one decision. But if you believe that the benefits outweigh the risk, then you make the other decision. As it relates to the COVID-19 vaccine, all of the vaccines, whether it be AstraZeneca, whether it be Pfizer, Moderna, Johnson & Johnson, the Sputnik vaccine, the Sinopharm vaccine, all of these vaccines have shown a better benefit to risk ratio. The benefits far outweigh the risks. And that's from all the scientific authorities around the world. not just in the Caribbean, not just in the US, but across the world, in Europe, in Asia, in Africa. The same is true for all of the vaccines. And what are we trying really? What is our primary aim to achieve with these vaccines? Is to ensure that people do not die from vaccines, or people do not die from the infection. And what we have seen, that all of these vaccines are 100% effective in reducing two things: severity of COVID infection and death rate from COVID infection. All of the vaccines have the same claim, and it has been shown to be so after thorough scientific scrutiny. The vaccines prevent death and they prevent hospitalization. All of them 100%. So with a benefit like that, then it's almost a very, very easy decision that once you're eligible for the vaccine, you should take it. Who should not take the vaccine? That is the other question. And this is a very small minority of persons. People who have a known severe allergic reaction to vaccines. Let me repeat that. The only reason why you should not take the vaccine, the only reason, is if you have a history of developing severe allergic reactions to vaccines. No other reason is strong enough to say you should not take the vaccine. If you had a history of a heart attack, you can still take the vaccine. If you have heart failure, you can still take the vaccine. If you have kidney disease, you can still take the vaccine. If your family or your friends, they're old and frail with diabetes, high blood pressure, they can still take the vaccine. The only reason to not take the vaccine is if the person has a known history of severe allergic reaction to previous vaccines or any of the components that are within these new vaccines. And that is extremely rare. So people have been taking vaccines in Guyana. As I said before, we are past 40,000 persons who are vaccinated. And across the Caribbean, there's an increase in the drive to getting the population vaccinated. There are some countries that have been very slow to adopt a vaccination protocol, but hopefully resources and availability of vaccines become easier, and so our Caribbean family can all become vaccinated and look forward to a normal return to daily activities. The most significant discussion around side effects for vaccines recently has really centered around the blood clot situation. There have been claims that there is an increase in blood clots from persons who have received the vaccine. Now, if you look across the world, what the statistic really is, in the ordinary population before COVID, for every 100,000 people in a population, there is about 60 to 80 persons who would develop a blood clot. That's 60 to 80. So let's say Guyana has, I don't know, 1 million people. You multiply that number by 10, that is 600 to 800 persons per year who would develop blood clots. Let that number sink in. Ordinarily, in Guyana, one would expect about 600 to 800 blood clots for the year. Across Europe, they had distributed or injected 17 million vaccines. 17 million vaccines. And they discovered after vaccinations that there were 32 cases of blood clots. Not 3,200, but 32 cases in 17 million. That percentage is less than 0.0001. So to stretch your imagination thinking that this is a real issue and a big problem is a little bit, it stretches the imagination for sure. But it does seem that it is much, much safer in the older population. And there may be an issue in some persons who have underlying clotting problems. But still, the incidence of blood clot in the vaccinated population is less than 0.001%. The incidence of blood clot in a general population without COVID, without vaccine, is 60 to 80 persons per 100,000 population. So the numbers do not support the claim that blood clots result from these vaccines in any major way. What are the real issues here? And why, therefore, are people concerned about taking these vaccines? The main concern that people have across Europe or across the world generally is that they do not think that vaccine may be safe enough. That's one. And the second biggest issue is that they are concerned about possible side effects. So almost half of the persons who oppose taking vaccines, they oppose it because they do not think that the vaccine may be safe enough. That's one. And two, they are concerned about the possible side effects. The number one and number two cause make up about 50% of all persons who are hesitant to take the COVID-19 vaccine. And so let us look a little bit about what are the common side effects for the COVID-19 vaccine. And this has been reported across all of the countries that started it. The common COVID-19 vaccine side effects include things like tiredness, which is, something that a couple of my colleagues would have experienced after getting their COVID-19 vaccine right here in Guyana. Some persons, including myself, had some pain at the site of injection. That's on my left shoulder. It lasted for about a day and a half, and I took Panadol or Tylenol, and it went away. And it was manageable. I was still able to function at work, and it did not cause any long-term effects. Some persons have also reported fever and chills. Now, I remember having some fever and chills which started about 12 hours after taking my vaccine. A very good friend of mine, his fever and chills started about 6 hours after taking his vaccine. And another very close friend of mine did not have any fever or chills at all, even a month later. So different people will respond differently to the vaccine. And when you get fever or chills or any kind of reaction from the vaccine, these are minor ones that I'm talking about. It's a sign that your body is responding and it's starting to create defense mechanism. Especially the fever and chills, that's an indicator that your body is starting to create its own defense mechanisms. Some persons have also claimed to have headaches as an after effect of the vaccine. Now, all of these things are not unusual with any vaccine, not just the COVID-19 vaccine, not just AstraZeneca, not Johnson & Johnson alone, but you can get these kind of reactions when you take the flu vaccine. A lot of people, especially the elderly, are advised to take flu shots every year, especially if you live in places like Canada and America. And these are often the same side effects that they experience that last a couple days, maybe 2 days, 3 days, after taking vaccines. They are not unusual. It is not something that is specific to COVID vaccine, but it is something that happens with pretty much all of the vaccines because they have to induce a response or a reaction in the body to fight off future infection. And the common ones that we look for are tiredness, pain or swelling at the site, fever and chills, and some people may have headaches. Luckily, in the COVID-19 vaccines that we are giving out, over 40,000 that were given to Guyanese so far, we have had no reports of any major side effects. No one has dropped dead, no one has developed any major allergic reaction, and we have no reason or no suspicion and no evidence to stop the program or alter the program in any way. So I hope this would have helped to give you a little bit more confidence as you think about getting your own vaccine or taking your family or friends and advising them to get their vaccines. I'm Dr. Mahendra Carpen, and remember, if you have any questions or comments, you can send an email to docandcovid@gmail.com or send a WhatsApp message to 620-6275. Thank you once again for joining me.